Madam President, I rise today to discuss S2087, the Medicare Protection Act. Over the past few years, I think one thing we've witnessed here is, unfortunately, an irresponsible few who are trying to turn Medicare into a voucher system and raise the eligibility age for benefits. This would not only have a catastrophic effect on seniors' health, but also on their financial security. It would force seniors to pay more for their doctor visits and for prescription drugs. And people in my state have figured this out. In fact, I recently got a little note from Philip in Jonesboro, and he said raising the Medicare eligibility age would shift thousands of dollars in costs to seniors and drive up premium costs. He got it exactly right. I think that's what it'll do. I think that's what pretty much every study that I've seen at least says it'll do. In Arkansas alone, we have well over 500,000 seniors who depend on Medicare. And I would encourage all of my colleagues to look at the numbers in their states. My guess is everyone has a large number of seniors in their state, and the seniors understand how vitally important it is that we protect Medicare. Turning Medicare into a voucher system or fundamentally changing it in any way by using some sort of voucher, or they call it like premium supplement, I don't know, they have a different word for it sometimes, or raising the eligibility age or cutting benefits would really be detrimental to the people in my state, and I'm sure in all 50 states. As Rebecca from Fayetteville said, she said, raising the Medicare age would simply force seniors such as my mother and me to pay more out of pocket. We need responsible, common sense solutions to keep Medicare strong. I agree with that. That is exactly what we need. We need these responsible, common sense solutions. Hopefully they're going to be bipartisan solutions. That's how you get things done in Washington, is by working in a bipartisan way. And I'm hoping over time this Medicare Protection Act will become a great bipartisan vehicle for us to protect Medicare. It really does two things, just in a nutshell. First, it amends the Congressional Budget Act to define any provision in reconciliation legislation that makes changes to Medicare to reduce or eliminate guaranteed benefits or restrict eligibility criteria as extraneous and an improper use of the reconciliation process. And I know that that's technical and that's kind of getting down in the weeds, but that's, I think, a very smart way to do it, is to use the Congressional Budget Act to protect Medicare. Secondly, it expresses the sense of the Senate that Medicare eligibility age should not increase and that the Medicare program should not be privatized or turned into a voucher system. Again, if you look back over the years, there have been attempts to do this, most of them originating in the House of Representatives, but we've had a few of those attempts here. But as Herbert Humphrey once said, the moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped. The Medicare Protection Act is the right thing to do. And I hope my colleagues from both sides of the aisle will look at this legislation, give it serious consideration, and join me in supporting this critical piece of legislation. It's a great way to protect our Medicare system. With that, Madam President, I yield the floor.